Hai, salam sehat dari Ohana Medical Group. Hari ini kami mengundang Jackie Tey dari Street Podiatri Singapura untuk menjelaskan kepada kita lebih banyak mengenai podiatri, treatment-treatment yang bisa dilakukan melalui podiatri. Jackie sudah berpraktek di Singapura selama lebih dari 10 tahun. Dia belajar dari Australia dan telah membantu banyak orang untuk treatment tentang kelainan kaki dan lain-lain. Mari kita tanyakan lebih lanjut lagi dari Jackie. Hi Jackie, good afternoon. Thank you so much for having us here. Jackie, we want to know more about podiatry. What kind of services actually that you provide for people?
Yeah, so actually podiatry might be quite new, especially in Indonesia. So what podiatrists actually do is we are involved in the diagnosis and also management of any lower limb conditions. And essentially we are talking hips down. So it could be the hip, the knee, or the foot and ankle conditions. The common conditions that we normally see in clinic are basically things like flat feet, high arch foot, ankle sprains, heel pain, one of the big ones, and of course skin and nail conditions such as ingrown toenail, fungal nail as well.
Okay, what's the difference between orthopedic and podiatry?
Oh, that's actually a very good question, and I think a lot of patients asked me that before as well. So if you think about it this way, if an orthopedic, let's say a foot and ankle surgeon, they are more involved in providing treatments in a more surgical or if not injectable manner.
Okay.
So whereas podiatrists, we focus solely on non-surgical care. So anything that doesn't involve cutting on the skins or injection, that's what we prioritize in the management of the conditions itself.
So when do we see you, or when do we see the orthopedic?
Essentially, I would say that it's either way, to be honest. So if let's say you prioritize non-surgical treatment and you want to find out what can be done without going through surgery, then podiatry is definitely someone they can look for. So certainly when we see patients coming straight to us, we will do the assessments, we'll do the diagnosis, and assess the severity of the conditions itself. Now, if the condition is something that, there's no need for surgery whatsoever, of course, that's something that podiatrists can help you recover. But also, if let's say we assess it and the condition is beyond what conservative options can help, then at the same time, we will then refer to a foot and ankle surgeon for surgical opinion.
I see.
Yeah.
So, can you share more about the treatment? How do you treat patients with heel pain or plantar fasciitis or flat feet?
Yeah, sure. So maybe we start off with heel pain first. Now, heel pain, a lot of people Google around, the most important thing about heel pain is that people will think that just doing a bit of stretching will work, changing a little bit of shoes will work, and then when they start having a lot of persistent pain, they don't know what to do. So the first thing that we actually do for heel pain is to assess the severity. Now, some people will have very mild strain and some people will have a very bad degeneration of the tissues. Depending on the severity, the options to manage it will differ. So the common treatments that we normally do, in particular to heel pain, is shockwave therapy, which is basically using a very high impulse sound wave to directly try to stimulate our own body's healing process. Yeah, so shockwave therapy is usually done across a few times to actually then help the tissue recover on its own. Okay. Now, when it comes to heel pain, we don't just look at the heel alone as well. We will then look at whether there's any contributing factors, such as a tight calf muscle, for example, or if the person, like what you mentioned, has a flat feet. Then in those kind of circumstances, then we will also need to look into doing things like a customized insoles to help support the foot correctly, so that will reduce the strain of the tissue at the heel.
So you are looking at the lower limb as a whole, then find out what's causing the heel pain itself.
Correct.
Then you treat the problem.
That's right.
I see.
Yeah.
Is it the treatment? Is it something that is permanent, or will it after they get better? Will it come back again?
Yeah. So essentially, that's also a very good question. So if we think about it, injury happens because the tissue or your body tissue could no longer handle the stress given on it. So same thing, if let's say we've done the treatment and you got all recovered, and then we revert or resume back to the old habits, and then putting a lot of stress without providing necessary support, then an injury can always happen again. So in sense, if let's say you protect yourself well enough, we can always prevent a recurring problem. But after we treat it, you feel better and you go back to your old ways, then I wouldn't be surprised if it happens again. Yeah.
So you will teach him on how to have a good posture habit maybe, or
Exactly. So it could be things like wearing the right shoes, how to stretch, how to manage your activities level.
Okay.
Yeah, of course, if let's say you're wearing insoles, how are they going to wear the insoles and what do they use it for? So we, like you mentioned earlier, we look at things as a whole. It's not just treating the pain, but also to make sure that they know what to do in the future.
Okay.
Yeah.
So after the heel pain get better, you mentioned that you will need to use insole for treatment of flat feet and heel pain. Is it a permanent insole, or do you, you will be able to not wear insole anymore after the treatment?
Again, a very good question. So this question, the answer will largely depend on the presenting problem. So if let's say a person coming with really bad flat feet, then to be honest, it will be something that they have to wear for a very long time. Because one thing about insoles like this, okay, is that when you wear insoles for a long time, it does not necessarily mean that you're going to have an arch later on, especially for an adult. Once we reach adulthood, our foot posture is set.
Okay.
Yeah, so the insoles will be there to help you reduce the stress when you're wearing it. But as soon as you step out of it, we're gonna expect you to have a flat foot again. However, if let's say someone has heel pain coming in from the increased stress level, but the foot posture is not extremely flat, then after the recovery period, they may or may not need to wear insoles for a long time. So it largely depends on the foot presenting to us. Essentially,
if they have flat feet, right?
Yeah.
Is there any surgical procedure that can be done to get the curve?
Actually, there are. In fact, there are multiple different surgical procedures that you can actually do to permanently correct the foot posture itself. The only question is this:
how severe it is?
Correct. How severe it is, and if it's something that you have tried conservatively and it didn't work, because of course all surgeries comes with risk. And then there's a recovery period involved as well. So we need to, of course, weigh out the benefits and the risks to know whether surgery is the right option for or not.
So is there, how severe is the flat feet or the heel pain that you have ever encountered?
I would say the most severe that I've ever encountered actually comes from a kid.
A kid?
Yes. So this is a good model showing a flat feet whereby there's a loss of arch, as you can see over here. Now, this is
not a normal feet?
This is not a normal feet. So basically you can see that actually the bones are almost lining up like a straight line over here, essentially. Now, this is what most people with flat feet would look like.
What would they feel if they have this feet?
So if they have this feet, for example, right, when we look at the foot itself, basically the whole foot is rotating inwards. So if you imagine there's muscles running on the inside of the ankle and also outside the ankle, the muscles act like a sling to balance up the foot so they remain stable.
So this muscle will work harder.
Correct, exactly. So if I put it this way, you can straight away get it. If your foot rolls in this way, all the muscles on the inner column will start to work harder, which is why a lot of these inner structures will then give you a problem at some point in life. If you have flat feet. Yeah, so that's how it works. So the most, I would say, significant or severe flat foot I've ever seen, like I mentioned earlier, was a child. So the flat foot is so severe that the outer part of the foot is not even touching the ground. So the kid is literally walking on the inner column. So he's
imbalanced when he stands up?
Correct. So the kid can't really walk a lot of steps without tripping and falling. And I would say that's the most severe one I've seen, essentially. Yeah.
So what would you do then if you have patients like that?
Okay, so of course, like I mentioned earlier, severity is one thing. We need to see how much flexibility the foot still has in order for me to determine whether or not insoles, for example, can actually help. Now, if insoles doesn't help to help support the foot upwards that way, there's also another thing called an ankle foot orthosis, like a big ankle brace. They would kind of hug the foot up in an upright position. Then that will be another option to look at. Now, depending on whether there's a necessary need or not. Like for kids, for example, there's a small little brace that we can hold them in. By holding the foot in a nice straight position, it improves stability. Then they're able to then, play with their peers and have fun in school, essentially. So there are various ways. Now, if none of these options actually help to provide a good stability of the foot, then that's where we need to consider whether a surgery is appropriate or not.
Okay.
Yeah.
So, what is the earliest age that they can start using this treatment?
So it's as early as 2-3 years old. So of course over here we see 3 groups of people. So the young ones really, when they started walking, and of course the teenage adulthood group and the seniors. So this whole range of ages, we have different sort of options for them. For kids, like I mentioned earlier, if they are 2 to 3 years old and they have severe difficulty trying to even balance and walk, then all this kind of little foot braces or insoles can come in to help with that.
Okay. So you also mentioned that within a certain age, our feet is like that. We cannot change it anymore, the structure.
Yes.
So what age is that? So at least, you should have treated earlier so it doesn't really form.
That's correct. So essentially for kids, right, all kids are born with pretty much flat feet and the arch develops over time.
Oh, is it?
Yes, correct. So by default or by theory, at the age of 9 is where we should expect them to be pretty much more or less fully developed. So you can expect feet to no longer change around the puberty age, essentially. Same thing, most parents will be surprised, how come my feet, my children's feet is so big when they're still so young. Same thing, our foot sizes tend to stop growing first before our height does. So most kids especially girls at 10 to 11 years old,
that's it.
That's pretty
max.
much. Yeah, that's pretty much the max for most of the case generally. Yeah.
Okay. So if they treat them early, it will be better so they can grow up normally.
Yes, but of course there's no a strong evidence approach to how to correct it without surgery. But of course there are ways to, number one, improve the stability first before we even look at correcting their foot itself. For podiatrists, we are more concerned on whether they are able to function.
Yes.
Yeah, that's why a lot of kids with bad flat feet, they struggle to be stable, they struggle to run, they struggle to jump because of the unstable foot posture they have. So that's the priority that we want to try to help them catch up first before we even look at correcting how the foot is.
When they do treatment early, can the arch formed?
Yes and no. Like I said, depending on how severe is the baseline is. But of course, it depends on the treatment as well. Now, treatment also largely depends on the duration they wear. The braces, for example. So we have cases whereby they improve quite significantly, but we have cases whereby there's minimal changes that way. But like I mentioned earlier, the most important thing that we want is for them to be able to walk stable. Yeah, because when they walk stable, they can then develop things like jumping, running and stuff like that and be able to catch up with their peers. And that's much more important than just the foot posture alone.
Okay.
Yeah.
Is it comfortable for the kids to wear the braces?
That's actually, generally speaking, there will be an adaptation period involved. But I would say kids adapt a lot better than adults. Okay. Then because they are more flexible in nature, putting them on a brace, for example, or like an insole, they tend to adapt much better.
I guess you need to weigh in the pros and cons of wearing the braces for their future.
Exactly. Yeah. I would say one of the most challenging part in terms of managing a kid is of course trying to get them to wear it. Some kids don't even like to wear shoes. Yes. And then we're gonna have a problem. Yeah. So I think those are more challenging than actually adapting to an insole or a brace.
That means it's important for them as their feet grows, they will need to change some of the braces, some of the shoes.
Yes, it all depends on the treatment duration required and of course, once again, the severity of their conditions. Okay. Yeah.
Can when you detect the foot structural abnormalities, right? Can it grow worse from when when they are young? Can it grow worse if there's no treatment?
Potentially, I wouldn't say that they will grow significantly worse. because that's how their foot is pretty much developed in that sense. So like I said, most kids, they will normally born with flat feet, and then they slowly develop arch. Same thing, as the muscle gets stronger, we should expect them not to sort of get worse naturally. But in the case whereby the foot is so severe that it led to a secondary problem, let's say for example a tendon damage because of the foot posture itself.
I see. It's the consequences of not doing treatment that is more...
That is more detrimental than it is. So when the tendon gets injured, they get weakened, then with that, you will expect the foot posture to may get worse at that point. Yeah.
Does this also shape their posture as a whole?
Yes, definitely. So a lot of people are not really aware that actually our flat feet doesn't really just
a flat feet.
Yeah. Exactly. So if I were to take this model for example, right, in order for the feet to sort of become flat, right, it will actually result in a rotational movement. Of course, this foot model isn't flexible, but as our foot rolls in, it will cause our shin to rotate inwards. So the whole entire leg will then rotate inwards, and it will then affect our hip positioning as well. So it has a chain reaction to it. Now, while that does not always create problem up the leg, but a lot of knee conditions, hip conditions, even lower back pain conditions can be associated to flat feet. Which is the reason why some patients will come in for us, not necessarily for foot issues.
For the back pain.
Yeah, it's for the back pain, but they know that they have flat feet and they want us to find out whether is it related to that or not.
I see. So if patient is not ready for the major surgeries, then podiatry is the next best solutions for to correct their feet and overall postures also.
Yes, that is correct.
Okay. You also mentioned that you do treat warts and other
ingrown toenails as well.
Yes, ingrown toenails. So how it is only done by podiatrists or other specialists also do it?
Okay, so for warts, for example, of course there's podiatrists and there's also dermatologists that can actually help with the condition as well. Whereas for ingrown toenail itself, is pretty much, I would say, a little bit like a bread and butter for podiatrists, because that's something that we see most common. Yeah, of course there will be other, like orthopedic surgeons, they might do some procedures for the ingrown toenail as well, but I would say generally podiatry should be the sort of the main one that people look for when it comes to ingrown toenail itself. Yeah.
So when you have ingrown toenails, it's genetic?
Not necessarily.
Not necessarily.
Not necessarily, yeah. So ingrown toenail.
It will forever be ingrown?
Not necessarily as well.
So after you treat it, it might not grow.
Correct. So
inwards anymore.
Exactly. So that's the thing. With ingrown toenail itself, right? We need to look at the shape of the nail. If the shape of the nail is completely curved from the root that way, then we know that, look, chances are even if I trim a little bit at the top, when the nail grows out, you're gonna keep having it again and again and again, which is one of the things that people come and see us. So because they try to cut it themselves, they go to pedicurists, it just doesn't resolve the situation.
It causes infections.
Exactly. They go to a GP or a doctor, they get some antibiotics. They felt a little bit better for 1-2 weeks, but because the nail is still in there, it then happens again after medication stop. Yeah, so in those kind of situations, we need to look for something more permanent. So we might have to do a little bit of a small procedure to sort of straighten out and remove the curved portion of the nail. Now, if let's say the ingrown toenail is caused by, say, for example, a fungal nail infections, yeah, so which is basically fungus growing underneath the nail. That can
How does fungal go into the nail?
Well, the most common, I would say, is due to some form of trauma. So let's say you drop something onto your toenail, it bruises the toenail, it creates a bit of a break in the skin barrier, then fungus can go in and breed that way. Now, that's one of the most common reasons we can have, we can find. Of course, sometimes going to pedicure salons may increase your risk of getting it, depending on what kind of services was being done, and of course the cleanliness of the tools itself. All these things matters as well. But the problem with fungal nail is that they are generally, of course, number one, affect the looks of it.
Yes.
But what most important is that they can change the shape of the nail. They can make it a lot more curved. Then that can create a ingrown toenail. then again.
So it's all related.
Sort of, yes, exactly. So when we look at the ingrown toenail itself, we need to figure out whether or not is it, like I said, genetics. Is it because, in fact, like they like to wear tight shoes, like no ladies pointed toe shoes? All these things can affect how the nail is and whether or not it pierces through the skin. And then with that, we have to determine whether or not which options are the best for them. Yeah.
Okay, as for the warts, right? What actually caused the warts to happen?
So wart is actually caused by a viral infection. We call it a human papilloma virus, HPV in short.
Yes.
Yeah, so this human papilloma virus, they will actually infect the skin. And what it does is that it causes the skin to increase, we call it turnover, which is basically generating more skin at a short frame of time.
Okay.
So one of the most common symptoms that people might find when they have a wart is that there is a hardened skin, thickened skin right at the area where it's affected. And when it gets really, really thick or hard, they can start feeling pain, essentially. Yeah.
It's kind of poking to the nerves on the sole, is it?
Sort of, essentially. It's just because it's a very hard lump of skin there. When they step on it, it then creates the pain sensation on it.
Does it spread to other locations?
Theoretically, it does. Especially if you like to pick on it using your fingers, then you can catch it on your fingers.
Oh my god.
Yeah, so if let's say you share shoes or share towels, for example, you can potentially get it. That is the reason why most people will catch the virus from what we call communal areas or areas where people like to walk barefoot around. So things like swimming pools, gym showers, these are the hot spots.
Is that easy to infect?
I wouldn't say it's that easy, but definitely if you walk barefoot and you share like common grounds like this with someone who has warts all over the feet, that increases the risk of catching it. Yeah, but most patients will ask me, look, if I caught it once, I treat it, will I ever get it again? Yes. And well, the answer is yes. So if we think of it like catching a flu,
it's like a flu.
Exactly. Yeah, it's a viral infection. So you don't naturally build a strong immunity against it. Yeah.
So medication is also necessary for this?
Not really. So a lot of this medication, even if you take orally, it doesn't really treat skin warts. So skin warts are normally done with sort of localized treatment. Either we freeze the wart or we actually have to physically remove the wart, depending on the severity once again.
This all can be done in the clinic setting?
Yes, definitely. Okay. Yeah, quite straightforward in a sense. Yeah.
Well, there's a lot of things that you know.
Yes. So for general public, we always say that look, from the skin down to the bones, as long as lower limbs, podiatries are sort of trained to handle it. The only time where we can't handle it is when the condition is so severe that it requires some form of surgery. Yeah.
Okay.
Yeah.
Thank you so much, Jackie, for your time.
You're welcome. Thanks for having me as well.
Thank you.
Yeah, thank you.